the late summer and maybe the early fall tourism season. What we should get on Monday is in the Order in Council, Dominic LeBlanc, the Intergovernmental Affairs Minister, made this kind of clear earlier this week, that we'll start to see dates beyond the 21st of June where new measures will start to come into force. The first measure we will likely see an implementation date for will be the ability to skip quarantine hotels and 14 days of isolation for fully vaccinated Canadians and permanent residents who are returning home. As long as they take a test, they get the negative result, then they're free to move about the country. So we're not expecting very specific border news from the Prime Minister today, though, as you're right, Ashley reported that we are seeing changes to apps and different things and how you can upload your vaccination documents and then make it easier for you to cross across the border. So we're getting a clear sense of how travel will work on an operational level when you reach the CBSA checkpoint and are coming in, but the dates and when the loosening of restrictions, that roadmap to easier travel, we should start to see that getting laid out on Monday. It is not going to be revealed to us today.
Yeah, and I think Bill Blair probably tweeted that so that the Prime Minister was not forced to reveal everything today, although he may still get some of the questions. And just a reminder to people that the Prime Minister himself only has one dose of the vaccine, so even if things were to change quickly, he would still be under these same rules because they will be for fully vaccinated Canadians. Janice, the app idea and how this is going to work is interesting because we are seeing some of that unfold in other parts of the world, and some countries letting other particular citizens from countries in. So this will facilitate travel, or it will at least allow Canadians to start potentially planning travel outside of this country.
Yeah, important just to be clear that this is just something for Canadians who are returning home or permanent residents, people who live here who are returning to Canada. It's not an app that will allow tourists or business travelers to enter and get into, through Canadian customs easier. Adding this feature to the ArriveCan app. Now, this app actually rolled out a few weeks ago. It's the new feature they're adding that lets you upload an image or a document file to show your proof of your second shot. This app is a bit of a stopgap measure, if you will, because the system they eventually want to get to, which is a fully digitized vaccination certification program similar to the e-passport system they have. That is not there yet. That is proving very difficult to build. They need it to be able to draw in data from all of the various provincial and territorial systems. It's a bit of a task, I understand, and it's not going to be ready until the fall. So we kind of have this interim step. Much like the slow, gradual, reopening plan, this is kind of like an interim thing they're doing, I think, to enable things like, as David said, people to bypass the quarantine hotels and some other kind of short-term measures they want to do, perhaps as we get into the midsummer. But a lot of people kind of looking at that July 21st date and thinking, man, another month, really? The government's got to be careful here that it tries to tread water for too long. I don't know how much longer people are going to be content with just kind of like, stay the course. They put some benchmarks down in terms of percentages of people being vaccinated. Last week, this week, the next week, what are we up to, like 15 million vaccines coming in this week and next? By the time all those go into arms, I think we will have hit those benchmarks they identified, and people are kind of like, you know what? Like, why do we not have a plan yet? And businesses especially. Chambers of commerce are getting so frustrated with this government and the lack of a clear plan on border reopening. Surely it's time for some more details.
Yeah, I believe that we're going to hit the 75% mark of people with one dose in the next day or so. So things are ticking along in terms of those benchmarks. I guess the other part of that question, though, David, is the lack of people vaccinated in the United States. So how do you open up the border to allow for our businesses and people to travel without then accounting for the fact that there are going to be people who are not double vaxxed in the United States who might want to come over here, and with the Delta variant, these are all things that have to be factored in.
Right. So a bunch of things. I mean, Canadians still can't freely travel around their own country right now. There are still border restrictions at provincial borders. So I mean, look, we all want clarity and we all want certainty, but welcome to the pandemic. You know, the variants are changing things to the point that yesterday we got brand new guidance on vaccines, for example, that has shaken the 1.7 million Canadians who've got AstraZeneca doses. So, you know, people need to relax a little bit, because I think the clarity will come, but right now they're at the tipping point where you're going to get to the critical stage of full vaccination in this country, and they need that incentive to stay in place.
Sure.
That you can't get back to normal until you get fully vaccinated. If you start loosening restrictions to the point to allow, you know, the old ways of doing things before people are fully vaccinated, or create some challenges. But look at the stories we've heard from businesses, Rosie, for example, just here in Ontario, with the snip, snap, open, close, open, close, open, close.
Yep.
They staff back up, they go back down. They buy a bunch of inventory, the inventory goes to waste because of the rolling restrictions. Apply that across the Canada-US border. You don't want to open it until you're sure it can stay open. And with things like the Delta variant and the way that that is going, if you look inside the numbers here in Ontario, some of the epidemiologists will tell you, yes, the transmission, the curve is bending down, but it's not bending down for the Delta variant. That is going up. So the race between vaccines and variants is not over. It's just the vaccines have a good head start this time, but that Delta variant is still a problem, to the point that the UK, which was way ahead of us in double dosing, is extended its shutdown by another month, deep into July. So before you open up to the US, which has stalled on its vaccination efforts, and I know people want to get back to Florida and they want to go cross-border shopping, and I have great empathy for the tourism sector, there's still a lot of volatility and uncertainty there. And I think the signal coming from this government is they're going to be super cautious on that, because the Ontario government, let's not forget, has been running ads during hockey games demanding tougher border measures, not opening it up, not making it possible for tourists. It's like, stop the planes to stop the variants. So while you don't even have a consensus at the premier's level on how to make this happen, and driving through Atlantic Canada, you hit wall after wall after wall of quarantine requirement unless you're from inside the bubble. I mean, the country's not even open, let alone being ready to be opened up to the U.S.
Yeah, I mean, it was interesting this week to see Western premiers, you know, start to ask questions about when the Canada-U.S. border would be open, but meanwhile, Western provinces aren't open to everybody. So, yeah, there are contradictions certainly in the policy approach from provinces, and I would say that the Canadian government certainly doesn't seem to think that there is an urgency to opening this border. Although, just to be clear again for people, that Bill Blair earlier this morning did tweet, the government is planning measures for fully vaccinated Canadians, permanent residents, and others who are currently permitted to enter Canada, and will provide further details on Monday, this coming Monday. So the plans are in the works, and we're going to hear a little bit more about them on Monday, but a full border reopen is not what is on the table right now.
And Rosie, I think they're probably further advanced than is being shared publicly. I think there's probably a lot of work being done at the back end of government with the roadmaps, but they don't want to lay it out until they're ready to go. We saw this with the vaccine rollout. It was further advanced than they would tell us in the early stages. I think it's a similar process happening here.
Yeah, and it certainly sounds like the development of an app, other than this Arrive app, which they've already talked about being used temporarily, is also underway, and also, as Janice mentioned, pretty complex. I'll just bring viewers up to speed, because we were hoping to see the Prime Minister before now, but the Prime Minister, as you may know, back from Europe this week and is self-quarantining at home, although he does have a negative COVID test and he does have one dose of AstraZeneca. But this has sort of complicated matters in terms of who is allowed on the Prime Minister's property, how close they can get to him, all those kinds of things. I believe we're now moving into a virtual press conference, in which case reporters will be on the phone instead of on the property, and the Prime Minister will take questions that way. So that's why potentially this is a little bit delayed, because the technical aspect changed a little bit. Maybe let's just do, because we were talking about how we are progressing on vaccines, first in the world with first doses, and moving rapidly up with second doses now. Maybe we should just do a go-round on sort of where we are with the numbers of vaccines entering this country. Janice, David has a head for this, so I'll start with him, and then I'll let you talk too. David might not like having a head for this, but that's what I've made him do over the course of the past 16 months. So.
It was easier to track it when the numbers were small. It's getting a lot harder now that the mRNA vaccine's coming in big numbers. I think, look, one of the things I'm being told we're going to get is information on July Moderna shipments. I'm told there's 11 million Moderna doses coming to the country in July. So you can see right away with Moderna over 9 million doses coming this month in June, plus another 11 million coming in July. You can see the benefit now of Canada being able to tap into the U.S. production facilities and supply chains from Moderna rather than relying on the European Union one, which is serving way more clients and has a much more laborious and difficult supply chain setup than the operations in the United States. But you do the math on that. I mean, I think we're going to be at around between 50 and 55 million doses into the country by the end of June. This would put us into the high 60 million doses by the end of July. You know, there's 34 million people roughly in Canada who are eligible for vaccines in the 12-plus population. So by the end of July, that's enough for everyone to have 2 shots. So right there, the supply will be in the country by the end of July for everyone to be done. So you could be looking at the first week of August. I mean, the rollout's still got to happen, and people still have to sign up, and you need the uptake. But you could have 100%. The capacity would be there. The supply would be there if it all arrives, and it is accelerating and becoming more and more reliable the deeper we get into this, for everybody to be fully vaccinated who's eligible, you know, by the August long weekend holiday in this country, which is quite a remarkable change from where we were on April 1. I mean, we have had more vaccine doses come to the country this week than we got from vaccine approval in December until the end of March. It's that kind of a surge. And we're likely to pass the Americans on second dose rates sometime between Canada Day and the 4th of July, oddly enough. That's when those lines will intersect. And that is a curve we do not want to flatten, the vaccination rate. It is going up, and public opinion polling shows you that 88% of Canadians say that they will likely get vaccinated. And it is trending in that direction. The doses are shifting very heavily to second doses. Now like 75, 80% of all doses given are second shots. But that just means that fully vaccinated graph is going even steeper and in a direction that we want it to go and that we need it to go. So the supply is there, and at this point, Rosie, it seems the willingness is there. I know there's some incentives like lotteries, but broadly speaking, Canadians want to get vaccinated and they want to get on with their lives.
Yeah, the government is not changing its benchmarks because it is better to exceed expectations than not. So so those are sort of the timelines that we can see out of the numbers, but the government still says, you know, by September, everyone should be fully vaccinated. Part of this comes down to as well how provinces manage the rollout. As we know, we've heard stories, certainly anecdotally in this province, people struggling to find a second dose depending on where you live. If you're not in a hot spot, it's much harder to do that than in others. And then this new guidance from NACI yesterday, Janice, around how to use the vaccines and the ongoing sort of evolving advice and recommendations around how to use the different vaccines, which, you know, I think if you're a person at home who's not plugged into this 24/7 the way we are, that it's hard to stay on top of what you're supposed to be doing for your second dose and your first dose.
Well, and a further complicating factor, of course, a lot of people, you know, those NACI guidelines come out and people treat them like rules when really they're just advice, right? And then you see how it plays out in the minds of different provincial health ministries. Quebec has said thanks but no thanks to this advice from NACI at several points this spring. I know Christine Elliott in Ontario, you know, where they are right in the thick of a heck of a time right now with their rollout and trying to keep the new variant at bay. She today has issued a letter kind of offering some clarity.
I'm sorry, I'm going to interrupt you because the Prime Minister's head has popped up here on his webcam. Yes. Okay. All right, I'll talk to both of you after that. I think he started. Has he started? Or is he doing a test? Here he goes. All right, here now the Prime Minister of Canada from his home in quarantine.
Live. Thank you. We'll go to the Prime Minister to begin.
Bonjour à tous. Good morning, everyone. Now, please don't be too worried. I'm back in isolation at home, but that doesn't mean you have to be. I've got some important news to share, which I'll do from quarantine here at Rideau Cottage. But before I get started, I want to address the hateful acts that far too many communities in our country have continued to face this week. It's unacceptable to see a swastika painted in Downsview Park in Toronto. It's unacceptable to have hateful graffiti painted on a mosque in Edmonton. Anti-Semitism and Islamophobia have no place in our communities, and hatred and discrimination of any kind have no place in our country. This is something we'll never stand for, because the cost of turning a blind eye, it's much too high. Together, we must always denounce these unacceptable acts and support communities. That's exactly what our government will continue to do. It's been a difficult few weeks for many people across the country. People in London continue to grieve the loss of the Afzaal family. In Indigenous communities, this has been a time of mourning. As a country, we have to continue to work for justice and building a better Canada for everyone. At the beginning
of last week and the beginning of this week, I had very productive discussions with the G7, NATO, and the European Union. During these different summits in Europe with our allies, we made significant progress, whether it has to do with ending the pandemic or creating jobs for the middle class. Of course, every person who comes back from abroad must quarantine for 14 days, including myself. And so over the next week and a half, I'll be working in isolation here at Rideau Cottage.
I want to share some important updates about vaccine deliveries, supporting communities, and our plan to safely reopen. Let's start with news on vaccines. Canada is getting millions more Moderna doses brought forward from our summer shipment schedule into June, and we're locking in shipments for the first half of July. We've worked hard with Moderna to make this happen, and we're also getting extra doses from the US. Minister Anand will have the breakdown of the numbers later this morning, but here's the bottom line. Just like we surpassed our delivery numbers for the first quarter of this year, we're doing the same for the spring quarter. That'll mean for the end of June, as promised, we'll be at well over 50 million doses total. And by the end of July, we'll be over 68 million doses for Canadians.
Canada is getting millions more Moderna doses brought forward from our summer shipment schedule into June, and we're locking in shipments for the first half of July. And we've worked hard with Moderna to make this happen. And we're also getting extra doses from the US. Minister Anand will have the breakdown of the numbers later this morning. But here's the bottom line. Just like we surpassed our delivery numbers for the first quarter of the year, we're doing the same for the spring quarter. That will mean that for the end of June, as promised, we'll be at more than 50 million doses total. And by the end of July, we'll be over 68 million doses for Canadians.
I want to thank Minister Anand, her department, and our teams in Washington, D.C. and around the world who are working to get Canadians as many doses as quickly as possible. A big shout out as well to Minister Haidu and everyone at the Public Health Agency and the National Operations Centre for coordinating the rollout across the country. We'll have more details to share next week about shipment dates for the new Moderna doses. And of course, we'll provide that information to the provinces and territories right away so that they can plan to get those doses into arms as quickly as possible. Because that's what this is about, getting you your vaccine as soon as possible, getting it to your parents, friends, and neighbors, because every dose keeps someone safe. And every dose is a step closer to the end of this pandemic for Canadians.
Thanks to the arrival of such a large number of vaccines and to the fact that many Canadians are enthusiastically getting vaccinated, we are putting an end to this crisis in Canada. Almost 75% of admissible or eligible Canadians have already received their first dose. Together, we will defeat COVID-19. It's important to keep getting the first and second doses as quickly as possible. This is what will allow us to see those who we have missed so much throughout the lockdown and to restart our regular activities that we like so much.
No one and no community will be left behind. On that note, I want to give an update on support for Saskatchewan First Nation in Ontario. In the last few weeks, COVID-19 cases have risen very quickly in the community, mostly among children. At the end of May, we approved a deployment of the Canadian Rangers to help get the situation under control. Alongside the community, they've worked very hard to keep people safe. But even so, cases remain far too high. That's why we're approving additional support from the Canadian Armed Forces for Saskatchewan First Nation. The Armed Forces will be in the community until at least the end of the month, to help with everything from isolation sites to delivering food. On va continuer d'être là pour
We'll continue being there for all communities during this crisis and during the recovery. Yesterday evening, I talked about this with the premiers of the provinces and territories. As I told the premiers, my objective is to help Canadians during this crisis, to continue distributing vaccines and collaborate so that we can reopen responsibly. And on that topic, reopening, our government will have more to update you on next week around our plan that will allow people to start traveling again while ensuring the safety of all.
Finally, this morning, I want to address some recent developments in the House of Commons. The work we do in Parliament matters. And it matters because it affects you, your family, and your communities. In the House right now, we're working to extend support that millions of Canadians need to get through the final stretch of this pandemic, from the wage subsidy to small business loans to the sickness benefit. Let's be clear. These benefits will end in a few weeks if the Conservative Party and the opposition parties continue to obstruct our efforts to pass legislation. Frankly, I don't think anyone is surprised to see the Conservative Party standing in the way. But it's disappointing to see the NDP and the Bloc both join in these political games. This is progressive legislation and a progressive agenda that will help Canadians. There's important work to be done. And not only on supporting people through this crisis, we're also working to ban the unacceptable, discredited, and harmful practice of conversion therapy despite opposition by Conservative politicians. And we're working to reach net zero emissions by 2050. In other words, we're working on what matters to you. Unfortunately, not all parties in the House of Commons have the same priorities. Not all parties are focused on having your back. Instead of finding real solutions to real challenges Canadians face, the Conservative Party is playing political games. Just yesterday, they put forward a crass political attack on a man who has spent a lifetime serving his country as a police officer, as a decorated soldier who served 3 tours in Afghanistan and now serves as Minister of National Defense. I've been fortunate to know Harj for a long time. He's one of the most honest and hardworking people I've ever met. His entire career, and now as minister, he's been dedicated to transforming the culture of our military. He's working to combat sexual misconduct in the armed forces, including on expanding the Sexual Misconduct Response Center. And he will keep doing that work. We know there's still much more to be done to protect all of those who choose to serve their country, so it's unacceptable that Conservative politicians would choose to slander Minister Sajjan's reputation instead of working with us to keep Canadians in uniform safe. I said it's unacceptable. I didn't say it was surprising.
While Aaron O'Toole is engaging in petty, underhanded politics, we and our team are focusing on the real issues. We support all the members of the armed forces. We support you and your family, and we're working every day to build a better future for everyone. Thank you. I'll now be delighted to take your questions.
Thank you, Prime Minister. We'll now start with questions. Operator, over to you.
Thank you, merci. Please press *1 at this time to ask a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. La première question est de Christian Noël de Radio-Canada. La parole est à vous.
Question. Hello, Mr. Trudeau. You said not long ago that there won't be elections during a pandemic unless Parliament is dysfunctional. And what's happening at the end of this session? Well, would you qualify that as being dysfunctional? Answer. We're seeing the level of toxicity and political games that the opposition parties are engaging in, especially the Conservatives. But we are still working very hard to adopt the elements of our budget that will help citizens, to help move forward legislation on net zero carbon emissions, and to get rid of conversion therapy. which is a terrible practice. It's appalling, and we will continue to work on the important things for Canadians. And I know that Canadians are watching very closely what the opposition parties are doing so that we can deliver together what's most important. Follow-up question. Well, I see that you didn't quite answer my question. Would you qualify Parliament as dysfunctional? I'll give you a chance to answer that. Unfortunately, there was another subject, so if you could bring that all together, that'd be great. When you talk about vaccine certification for Canadians and permanent residents and soon travelers, what are the major obstacles with provinces that still need to be settled before putting that in place? Follow-up answer. Thank you, Christian. First, we will see if we manage to adopt those elements of legislation to help people. We made a promise from the outset that we would be there to support Canadians, and it's very unfortunate that the other parties don't seem to take those responsibilities seriously. But I still have hope that we'll be able to adopt the elements of the budget that will help people, and that we'll be able to adopt legislation on carbon neutrality. And I ask all other parties to do their part so that Parliament can continue to function. As for the vaccination certification, we are currently working on a solution for the medium and long term. So this would be something that would be easily recognized and standard for other countries so that Canadians can travel. And we are working in a very positive direction with the other premiers who wish to work with us to make sure that they're still keeping an eye on Canadians' data, but that they hand it over to the federal government so we can proceed with a national certification for travelers and people who want to go abroad. But in the meantime, we're working with the ArriveCAN application, which is already well established and being used for Canadians and travelers coming to Canada under the current rules. This way, they can share a photo of their vaccination record to prove that they can cross the border, and this proves that they were vaccinated. This is not an ideal solution, but it is a solution that we'll be able to implement quickly so that people can at least have a few other options in their back pocket if they are fully vaccinated. And this will be a more long-term and there will be a more long-term and robust solution in the near future.
Thank you, sir. And I've had a reporter ask you to repeat that in English, please.
We are working on two tracks in terms of proof of vaccination for Canadians who wish to travel. First of all, in the initial phase, we're going to be working with the ArriveCAN app in ways that people can upload an image of their paper proof of vaccination or online proof of vaccination so that the border agents on their return to Canada can verify indeed that they are fully vaccinated. That's something that we will have in place in the coming weeks so that people can have a few more options if they're fully vaccinated this summer. But for the fall, in the medium term, we are working with the provinces to establish a national certification of vaccination status that will be easily accepted around the world for people who need to travel internationally. And that will involve working together with the provinces, because the provinces, of course, have your health data and your vaccination status. And we want to make sure we're both protecting privacy and protecting jurisdictions, but getting a clear federal notification that other countries can see that we have that you've been fully vaccinated. So that's what we're working on for the medium term, but there is a solution for the coming weeks through the ArriveCAN app.
Thank you. Next question, please, operator.
Thank you. The next question is from Ryan Timilty of the National Post. Please go ahead.
Yeah, sir, I'm wondering if you can explain a little bit more why you chose to extend the border provisions for a full extra month and why fully vaccinated travelers wouldn't be able to cross the land border more simply.
As we said, we are looking forward to getting back to normal as quickly as possible. but we're not out of this pandemic yet. We're still seeing cases across the country, and we want to get them down. At the same time, we also know we have to hit our targets of 75% vaccinated with the first dose, at least 20% vaccinated at the second dose before we can start loosening things up. Because even a fully vaccinated individual can pass on COVID-19 to someone who is not vaccinated. And that means we have to really make sure that not only people who are fully vaccinated can travel, but that the communities to which they will return are not at risk, because even though they are protected from hospitalization, the people around them might not be. That's why we are sticking with our principle of doing everything necessary to keep Canadians first, keep Canadians safe first and foremost, even as we move forward on loosening restrictions in a responsible way. That's what I talked with the premiers about last night, and I can tell you there is a tremendous focus on making sure we're working together to do this as quickly and safely as possible, because we all want to get back to normal, which means, yes, moving quickly, but it also means avoiding any further massive waves.
Et en français, s'il vous plaît.
Repeated in French. We just had a discussion with premiers last night. It's important to highlight that we have set an objective at the federal level of 75% for the first doses. We're currently on our way to reaching that, and 20% for those with the second dose. We're not there yet, but we do expect to be there in the coming weeks, and that's great. And we encourage everybody to get vaccinated and get their second dose as quickly as possible. It's important to remember that even if an individual is protected from the worst possible consequences of COVID-19 with both doses, this does not mean that the person can't transmit COVID to someone else within their community or family, even if they got both doses. So it's not just a question of saying, great, you're protected, you've got 2 doses. It's a question of protecting the community that may not have second doses for everybody. So we're going to continue moving forward and relaxing the rules in a responsible way so that individuals who are fully vaccinated can work, rather travel, but we don't want them to be putting at risk other Canadians. It's always the balance that we're looking for. I know people are impatient, but nobody wants to see another wave of COVID-19.
Follow-up question, Ryan?
Yeah, sir, you mentioned the figure of 68 million vaccines by the end of July. By my quick math, that's enough to vaccinate all Canadians under the age of 12, over the age of 12. You frequently set September as the target when you expect all Canadians to be fully vaccinated. Given these new doses, given this number, do you expect that to happen sooner than September?
We certainly are very hopeful that everyone who wants to is going to be fully vaccinated before September. As you say, we have numbers of vaccines coming in by the millions in the coming weeks and into July. And that's great news, because the sooner the largest possible number of people get double vaccinated, the sooner we're going to be able to get back to more and more normality. And that's what we all want. So we're continuing to do our part in working hard to get doses in as quickly as possible, to bring doses that we've ordered for later in the summer and into the fall forward as we need to max out the vaccination process to get it as quick as possible. The provinces are continuing to step up their delivery of doses into arms across the country and are doing a great job. And all Canadians are doing their part by showing enthusiasm and positively and understanding that the more of us get 2 doses, the more we are protected individually, but the more also our community is protected, and therefore we can get into a better summer and a much better fall.
Merci. Prochaine question. Operator.
Thank you, merci. La question suivante est de Lina Dib de la presse canadienne. La parole est à vous.
Question. Hello, Mr. Trudeau. I'd like to know where discussions are at with the Americans concerning the AstraZeneca vaccine. Some people received it once. And what about the second dose? With this vaccine, Considering that the Americans don't want to recognize that vaccine, what will that mean for Canadians who want to travel? Answer. This is a question that was raised during discussions with the Americans. We recognized 4 different vaccines as being safe and efficient in Canada, but we know that other countries, including the U.S., have approved other vaccines that we haven't, or don't recognize ones that we have. And so there's going to be coordination and collaboration work that's necessary across the world to make sure that people who are vaccinated and protected, and who are protecting the community against COVID-19, can still travel. These are discussions that are ongoing. We will definitely make sure that people who got 2 or 1 AstraZeneca dose will not be disadvantaged when they want to travel. But these are discussions that will end in the next coming weeks so that people can start traveling. We're not quite there just yet.
And in English, please.
Yes, this is an issue that has come up. That different countries have different lists of approved vaccines. Canada has approved 4 vaccines as safe and effective, and we'll be recognizing those for travelers coming to Canada when the time comes, but certainly recognizing those as protecting Canadians. Other countries who haven't recognized the full suite of vaccines is an issue that we're going to have to deal with, hopefully in the coming weeks. We are engaged in discussions with Americans on that and with partners around the world to ensure that people who are protected from COVID-19 are able to travel. But we hope to be able to resolve those issues in the coming weeks in time for bringing in of loosened restrictions around travel.
Question. So if I understand, Mr. Trudeau, you still don't have any guarantees that you will be able to cross that border and go to the U.S. And can you also explain to me why we needed to go get 1 million doses of Moderna from the Americans, since we already have lots, and a lot of countries don't have any? Answer. First of all, there are a lot of questions being asked still concerning international travel, and different countries are studying the conditions. The United States haven't said yet what their criteria will be and how things will evolve in the weeks to come. We're working with them to get on the same page. But people who are fully vaccinated here in Canada, there are a lot of advantages regardless of the approved vaccine. Well, that is a priority for me. And as for the other question, my responsibility is to make sure that Canadians get vaccinated as quickly as possible. And as you've seen, we talked about 100 million doses that Canada is committing to sharing with the world. We will continue to do our part across the world, all while making sure that Canadians are getting vaccinated as quickly as possible.
Merci, thank you. The next question is from Tonda McCharles of the Toronto Star. Please go ahead, your line is open.
Yes, hi, Prime Minister. Thanks for taking our questions. As early as April last year, you stood outside Rideau Cottage and told the country that vaccines were going to be the way out of this, and yet here we are more than a year later, 6 months after vaccines have entered Canada. And so I'm very curious as to how do you explain to Canadians how it's possible that the government still does not have the ability to roll out a system of vaccine certification, and why you haven't addressed the scientific recommendation that was made 6 weeks ago to end the 3-day hotel quarantine?
Okay, first of all, Tonda, Canada is at the very top of the G20 in terms of numbers of Canadians who've been vaccinated with at least 1 dose. Our rollout of vaccines has been extraordinary. And I want to thank not just all the folks who've worked hard on signing the contracts, on delivering on those contracts into Canada so that we are in an enviable position from people around the world, but also all the frontline healthcare workers in the provinces across the country who've been delivering those vaccines by the millions into Canadians. And I have to also thank all the Canadians who have stepped up with enthusiasm to get themselves vaccinated, to protect themselves, but also to protect their loved ones. That is something that has been a tremendous success and certainly is something we're going to continue to make sure we push through to the end on and get everyone vaccinated by the end of the summer, hopefully, so that we can have a much better fall. In terms, what was the second part of your question, Tana?
Well, my question is not about vaccination. My question is about how is it this much later you don't have the ability to roll out the vaccination certificates to allow people to travel? How is it that you haven't lifted the hotel quarantine? So I'm just repeating my first question. That's not my follow-up.
Yes. Good. Fair enough. We'll give you your full set of questions, Tonda. No, thank you. First of all, the certification is something that we have to work on with the provinces. The federal government doesn't have records of vaccinations of Canadians. In our country, we have a division of responsibilities in regards to the Constitution that allows the provinces to be deliverers of healthcare and keeps them in control of the healthcare system. So that is why we are working with the provinces on establishing a formalized certification of vaccine. But you will understand that the priority in the provinces and indeed across the country was rolling out vaccinations and controlling the spread of COVID-19. And that is what we have worked on. Now, as we get closer to reopening, we have a path towards people using their proof of vaccination that they have already received to be able to travel this summer, but we will have a more formalized process in line with what countries around the world are doing in order to keep people safe. And that, in terms of establishing international norms, in terms of making sure they're actually approved and usable in all the countries that Canadians want to travel to, will take a coordinated effort by the world, even if Canada is advancing faster than the rest of the world in terms of vaccination, as you know. And in regards to the government-approved accommodations, I think people need to understand what the principle and why that was brought in. It was brought in to ensure that the arrival test that someone takes is negative before they return home to their family to their 2-week quarantine. That's why we brought in that up to 3-day government-approved accommodation as a way of ensuring that anyone who was traveling has a negative result here in Canada before they're able to go off on their own to quarantine at home. So in many cases, those results have come back quickly and people haven't had to stay all 3 days. But we brought that in as a way of ensuring and reassuring Canadians that people traveling into the country are not a significant source of spread of COVID-19, and it has worked.
Follow-up, Tanda?
Thanks. My next question, notwithstanding everything that you said about your Minister of Defense, why do you not replace him, given the lack of confidence that the House of Commons has expressed and many others outside the Commons and in and outside the military have expressed?
I think it's unfortunate to see that opposition parties in the House have descended to a level of crass personal attacks that, quite frankly, is not what Canadians are looking for and looking at right now. I have worked with Harj for many years, and I know the level to which he is dedicated to transforming for the better the culture of the military in many ways. He's certainly not a part of the old boys club that is causing such problems right now in the military. and the work that he and so many other individuals and organizations are doing to make sure that every single woman and man who serves in the armed forces is properly supported, properly protected, given the resources when unacceptable acts happen, and given the supports necessary, but also end the culture that has tolerated harassment and misogyny for far too long, along with other types of discrimination in the armed forces. He continues to have my confidence. He is the right person for the job.
Thank you. Next question, operator.
Thank you, merci. La question suivante est de Boris Proulx. Le Devoir, la parole est à vous.
Question. Hello, Mr. Prime Minister. Earlier, you talked about a possibly dysfunctional parliament. You mentioned the C30 and conversion therapy, carbon neutrality bill. About C10, have you abandoned the idea of getting it adopted by Wednesday? Answer. No, we still are hoping to move it along as much as possible. That's for C10. Unfortunately, the political games that are being played by the Conservatives around that bill are very dismaying. And we see that there's similar games are going to happen in the Senate. We're going to continue moving forward on it because we know to what extent artists are important and the world is changing. And we want to make sure that the rules that apply to our TV and radio stations for decades, we want to also find a way for people to operate in a new digital era. Netflix, Spotify, that's going to be very important. Unfortunately, the Conservatives once again are showing that they are completely indifferent to the arts and culture sector. And they're blocking this project for silly reasons, and we're going to do everything we can to move things forward. But there are limits to what we can do. We're in a minority situation, and the Conservatives really want to to make things difficult for our artists across the country.
We know how important it is to make sure that the very same principles that have ensured that Canadian artists succeed by ensuring that radio stations and TV stations and networks across the country over the past decades have always been there to support and promote Canadian content. The world is changing. We need to make sure we find out ways of promoting and supporting Canadian content, and the artists and producers and workers in our cultural industries are successful in a world of Netflix and Spotify and online streaming services. That's what C10 is all about, and that's what we're very much focused on moving forward. Unfortunately, the Conservative Party that has never been there to support creatives or artists or our cultural industries in this country is choosing to block and obfuscate and spread misinformation and disinformation. And unfortunately, we're seeing that it is likely to come from the Conservative Party in the Senate, where they still play partisan games, even though the rest of the Senate is working hard to be more independent. So we are hopeful that we're going to continue to be able to advance on this, but the level of partisanship and the low level of support for our artists from the Conservative Party is indeed of concern.
Follow-up question. You mentioned the dysfunctional parliament and the matter of elections. In your opinion, would it be wise or safe to hold elections before the border with the U.S. reopens or before the population reaches 75% for the second dose? Answer. Of course, as we said at the beginning, our priority is to be there to help Canadians to send them necessary support, not just to be protected during this pandemic, but to make sure that we have a strong economy and an economic recovery that includes everybody. We have put forward proposals and bills, including our budget in 2021, that we're still working on to get it through the House of Commons, which will be there to help people. Of course, conditions are improving bit by bit across the country. We're getting closer to the 75% mark for first doses and 20% for second doses. We will be passing those throughout the summer. But the safety of Canadians will always be at the forefront of our reflections, and we always find ways to help them every day during this recovery.
Thank you. Next question, please, operator.
Thank you. Our next question is from Mia Rapson of the Canadian Press. Please go ahead.
Hi, good afternoon. So you are one of the 2 million Canadians who got a first dose of AstraZeneca, and we've had another change in guidance this week on what people should do now. It's saying preferred to get a different second dose of mRNA. A lot of people are angry again. I'm just wondering what you can say about what you plan to do. What you said a few weeks ago, your doctor had advised you to get a second dose of AstraZeneca, if that's changed for you, and what you say to Canadians who, again, are confused and a little bit alarmed that the guidance constantly changes and they're not sure what to do.
Every step of the way, the scientific guidance has evolved based on data that's coming in from Canadians, from studies around the world, so that we can make the very best choices to keep Canadians safe every step of the way. The one thing that has not changed is that all the vaccines approved in Canada are safe and effective against COVID-19. So anyone who got any of the vaccines approved in Canada did the right thing, because getting them early, as so many Canadians have, and getting them quickly has been part of the story that we're showing, where we're leading the world in terms of vaccination, and we're on our way to getting through and into a much better summer because of it. Like many Canadians, I am looking forward to my second dose, which I hope to get soon after coming out of quarantine in the next few weeks. But as to which dose, I will take whichever dose is offered to me. I will do what all Canadians should do, which is follow the best advice of the experts around them, including NACI and their family doctors. And I will be reassured, as all Canadians should be, that getting that second dose is the best way through this pandemic, not just for you, but for the people you love.
Follow up, Mia?
Yes. So you talked earlier about negotiations and discussions with the Americans in particular on getting vaccines that aren't authorized there to allow Canadians to travel. But what is Canada willing to do about Canadians or others who want to come into Canada who haven't been vaccinated with the vaccine that we have authorized? What are we going to do about looking at vaccines and allowing people in who aren't using one of the 4 vaccines we've authorized?
That's an excellent question, Mia, and it's certainly something that we will have to resolve before we reach that moment of reopening to foreign travelers and people coming into the country. I can assure you that our medical community and our experts are looking very carefully at that, including also looking at what the WHO approved vaccines are. And I think that may be a path forward for the world. But we will make sure that every step of the way we're doing what is protected for Canadians, what is going to keep us safe, not just from cases of the virus, but from future waves and other variants.
Thank you. And we have time for one more question. Operator?
Yes, and our last question is now from David Aiken of Global News. Please go ahead.
Oh, thanks very much, Prime Minister. I guess one of the things I'm sure a lot of reporters have heard from are families in the United States and Hong Kong and the UK, where mom and dad are fully vaccinated with a Health Canada approved vaccine, but the kids are 7, 8, and they have not qualified for a vaccine program. Can you give us your thinking about, I know we want to let fully vaccinated Canadians come into the country without having to quarantine, but what about the families with kids who haven't qualified for a quarantine program? Can you talk about that?
Yeah, no, that's a really, really good question, David, and it's something that is posing a bit of a challenge because at this point there aren't vaccines that we're delivering that are approved for kids under 12. We're hoping that's going to change by the end of the summer, but we need to allow the researchers and doctors, the experts, to do their work to make sure we're keeping our kids safe. We know a couple of things about kids, and of course, the doctors who are speaking a little later can fill in more information on this. But my understanding and what we've seen is kids are at much lower risk of complications from COVID-19 and hospitalization, but they can still transmit and carry COVID-19 and therefore are a matter of concern when it comes to traveling and having kids come into Canada. We're looking at things, understanding that for parents to not have to do quarantine, but kids to have to quarantine for 2 weeks for 2 weeks might be difficult for the families. But every step of the way, we have and we need to continue to put the safety of Canadians first and prevent transmission or spread of COVID-19 and new variants. There may be something we're able to do around repeated testing and guidelines. There may be something we're able to do around other things. We're looking at all that because we recognize that is a gap that is concerning for many families. We will do the best we can based on the best advice, but our priority always needs to remain keeping Canadians and travelers safe.
En français, s'il vous plaît.
Okay, thanks. And just sort of a follow-up on
Answer in French. Answer repeated in French.
Oh, sorry, go ahead.
Just let me answer in French. I hadn't heard Alex.
It's a very good question because there isn't a vaccine currently for children under 12 years of age, and vaccine manufacturers are currently doing trials to see how we can better protect children and to find out if vaccines are a good approach for children. We recognize that families with fully vaccinated parents who want to come to Canada and they will eventually not have to do a quarantine, they might be in a difficult situation if the children have to quarantine. So we're studying that reality. But at each step of the way, we must do everything necessary to ensure the safety of Canadians. And we have to avoid the spread of COVID-19. So we will continue working with the international community, with experts and our allies and doctors to overcome this challenge. And it is indeed a challenge, and we'll be dealing with it in the weeks to come, because even though children are at less risk of having complications, if they contract COVID-19, they can still transmit COVID-19 to more vulnerable individuals, and then they could suffer more serious consequences.
Thank you very much. Yes, so a lot of people are frustrated about the pace at which we're easing the restrictions on border travel, and I'm sure you're hearing that from your own caucus colleagues. In fact, yesterday, your caucus colleague Nate Erskine-Smith had this comment. I'm going to read it verbatim to a panel on tourism. And Nate said this. He said, quote, "We have an expectation that our representatives follow the science to impose public health restrictions on our behalf. We also ought to have an expectation that they follow the science in lifting those restrictions." End of quote. Now, as you know, your expert panel, Dr. Naylor, has said it's time to get rid of quarantine hotels. In fact, he said it a few weeks ago, and it is time to start easing some of the border restrictions. Nate is frustrated about this, and so I guess the question is, why now are you, the head of a government that says it's into evidence-based policy, ignoring the evidence and ignoring the advice of your scientists?
Thank you, David. The reality is we are actually following the advice of the range of experts that we talk to. And of course, as we've seen a number of times through the pandemic, there are different perspectives from different experts. But let me talk about the element that a lot of people overlook when it comes to fully vaccinated travelers. If you are fully vaccinated, we're going to allow for easing of restrictions and allow for more travel. Because you yourself, as a fully vaccinated individual, are protected from the worst consequences of COVID-19, hospitalization, critical care, those sorts of things. That's what vaccination does. It doesn't, however, protect the community around you from catching COVID-19 from you. So when we look at permission to travel, yes, we're going to be easing restrictions around fully vaccinated travelers, but it matters also the level of protection and vaccination in the community to which they return. That's why it's not just about saying, okay, if you're fully vaccinated, have fun, go with it, run around. It's about saying that you're still returning to a country where we haven't yet reached high enough thresholds of second dose vaccinations. Now, we are getting there. We're getting there quickly. But that's why we're looking at a phased approach to easing border restrictions. Not because someone who's fully vaccinated today will be safer 3 months from now, but because the community they're in, the community they're returning to, will be better protected 3 months from now than they are today. That's why there is a progressive approach to a gradual approach to those restrictions, which I get it is frustrating for a whole bunch of people who just want to get back to normal. But it's really important that we continue, as we have from the very beginning, to keep Canadians safe. And if we are able to avoid more outbreaks like we've seen in some places across the country, even recently, by delaying a little bit more, by keeping people safe, so we're not seeing more people in hospitals and more people and more families losing loved ones, then that's the right decision. I get people's impatience, both in the tourism industry and individual Canadians who want to travel. But from the very beginning, we as a government have been there for Canadians, and that means doing what's necessary to keep them safe.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.
Thank you very much, everyone.
All right, that is the Prime Minister of Canada on this Friday, coming to us from his home at Rideau Cottage. He is in quarantine after traveling overseas, testing negative, and now staying at home for a period of 14 days. I'll bring back my colleagues, the CBC's David Cochrane and Janice McGregor. Lots of news there. Let's start with the early headline from what the Prime Minister had to say. Then I want to talk to you a little bit about some of the tone of the comments.
Rosie, I'm going to interrupt. I don't know
comments.
if you can hear me, but I have lost contact with you, and I have lost contact with the show, and I cannot hear anything. Okay. So I just want to let you know I'm not ignoring you. I just can't hear you, and we're going to try to reconnect so we can chat.
Okay. Good. For a minute, I thought David had more news that he wanted to bring us. We will reconnect with David, and I'll start with Janice. Janice,
I'm still here.
Okay, good. I'll take whoever's here, Janice, frankly. So some significant news in terms of the pace of delivery of vaccines today, happening, not more vaccine, but getting here much faster than we expected.
Yeah, the acceleration, right? Talking about sort of doses from the second quarter being kind of moved up, or from the third quarter now, if we're talking about July, right? Being moved up, pardon me. This is why you need David. He's better at the vaccine stuff, Rosie. But look, when you hear them talking about the numbers, I think it's important to understand how this translates kind of into a granular kind of business on the ground in a world where a lot of people are still waiting for their second appointments. What does this mean when we hear these kind of big deliveries? And we're going to hear more about that at the public health briefing that's coming up shortly. Like here in Ottawa, for example, this isn't necessarily a hot spot, but we found out today they're opening 5 more sites. So kind of the big influx of vaccines for the next couple of weeks means there will be 5 more places where you can sign up to get shots, I think starting today. This is the big lift that Krista Brody was talking about yesterday during the vaccine technical briefing as well. The government really hoping that this is going to be seen by people as success. You heard the question the reporter put, are you going to move up the deadline, right? You said everybody would be guaranteed a second shot by September. Are you going to move that up? Because it's looking like now, midsummer. The Prime Minister, trying to be cautious, right? But the reality is the numbers they're putting out there for us do now look like that is where we are going to land.
Yeah, in case people missed off the top, we were supposed to get, I'm not going to go with what we were supposed to get. We'll be at more than 50 million doses by the end of June. But by the end of the July, we'll now have more than 68 million doses for Canadians, which would easily vaccinate the population of Canada that's over 12. And this is, and I think David's back now, Janice, so I can put this question to him. I didn't know what was happening there, David. TV, so great. So this is largely because Moderna is able to deliver faster and more regularly. We're going to hear some of those details from Anita Anand, but that's why we're going to get to that big number by the end of July.
Yeah, look, like with Pfizer, in the early stages of the vaccine rollout in this country, the deliveries were coming from Europe, right? I mean, Pfizer was coming from Belgium. Moderna had a more complex supply chain where part of it was done in Switzerland and then finished in Madrid and then picked up and flown over here. Now with the U.S. essentially being fully sufficient on supply, although they are running out of arms because vaccine uptake has slowed down quite considerably, Canada's been able to tap into that, and it's been an absolute game changer when you look at the pace of deliveries. Moderna is ratcheting up to pretty much a Pfizer level of delivery schedule. I mean, Pfizer got to the 2 million a week stage and now up to 2.4. I know there's going to be a bit of a slowdown in July, more of a backloaded July delivery schedule with Pfizer. But a bad week for Pfizer is going to be still close to 1 million doses, right? Which, when you compare where we were. But it looks like 11 million Pfizer doses coming in July. And the Prime Minister, he didn't have the specifics, but he says some of the later summer deliveries are going to be moved up into the spring type thing. So I think maybe some doses that are expected later in the year are going to be accelerated and maybe either come this month or come at some point in July, or things will be front loaded in July. But Moderna, they were counting on it, but it was incredibly inconsistent and incredibly unreliable. For months and months and months, deliveries were either late or short. And that caused a lot of chaos at the provincial level in terms of booking shots and planning rollout. Well, now we're kind of getting this glut of mRNA with Pfizer and Moderna delivering so consistently. But this is the game changer. I know the people working on the deliveries, working with the suppliers, were counting on that if they could just tap into the U.S. from Moderna the way they did with Pfizer, everything would go gangbusters in Canada. And you look at these numbers, 20 million Moderna doses at minimum for June and July is what it looks like now. So that's pretty good math when you're trying to get your population vaccinated. So 12 plus, there should be enough to get it done. And pretty soon, those vaccines will be in the approval pipeline to start doing under 12. So pediatric vaccinations can start maybe by this fall, should the science on it stand up, because the supply looks like it's going to be sorted out.
I want to talk to you both just about a question both about politics, but I'll just point out the Prime Minister was also asked around, what happens for travel for people who have had one dose of AstraZeneca, like himself, for instance, to the United States. Because right now there are some areas where they're saying, oh, if you have AstraZeneca, you are not going to be able to come into the country. He says it's an issue that they are working on and dealing with. So if that affects you at home, that is being addressed by the government right now, and they plan to somehow resolve those issues in terms of restrictions. Lots of questions also about the border and fully vaccinated people. Again, we're going to hear more about a little bit about how things are going to unfold on Monday. I just wanted to ask a political question, though, of both of you, because the Prime Minister did spend the back end of his comments speaking about what's happening in the House right now, both a motion to find the Public Health Agency in contempt for withholding documents around the laboratory in Winnipeg and the dismissal of 2 scientists there, and the censure motion that was supported by opposition parties last night against Harjit Sajjan. The Prime Minister said that was unfortunate, that the opposition parties had, quote, descended to a level of crass personal attack. I do think there is such a thing as ministerial accountability and responsibility, and that is, I think, why the opposition parties are trying to call out Harjit Sajjan for the ongoing allegations around sexual misconduct in the military. Anyway, let me get your perspective on both of that from both of you, because it did feel, I don't want to say pre-electoral because that's easy, but it was a very aggressive defense of his defense minister. David, I'll start with you.
It's easy to call it pre-electoral because it probably is, Rosie. I'm supposed to take a vacation in August, and I expect that to be completely detonated. Because look at the two things we're talking about here today: the acceleration of vaccine deliveries to the point that the country can be fully vaccinated pretty much by the middle of August, and the opposition majority in a minority parliament using its numbers to find the Public Health Agency in contempt of Parliament and to censor the Defence Minister Harjit Sajjan. If you're the government and you are looking at a fall where, if you do not call an election, where a muscular and determined opposition is going to use its clout in Parliament to keep doing things like this to you, and you've just gotten to the point where people are getting their second doses and you are keen to get a third term, why would you go back into Parliament in the fall and face the opposition, face the committees, and being dragged in front of it and unable to stop it or control it because you're in a minority, and lose the goodwill you could earn with the Canadian voters by getting to a level of full vaccination, maybe faster than any other country on earth? Now, I'm not saying the opposition is wrong to do these things. I'm just looking at the calculation on the government side. And the polls right now would suggest, at worst, they come back with a pretty good minority, and they've got a shot at a majority, because even though the top line numbers are kind of close, they're pretty good in the BC Lower Mainland, the GTA, and other parts of the country. And the delay of legislation like C10, the cultural industries legislation, that's an issue for them that they want to campaign on in Quebec. And so there's a lot of those factors. And so, it's simple to call it pre-electoral, but Rosie, it's probably because it is.
And the Prime Minister did outline some of the things that he believes the opposition parties are holding up there, blaming them for not allowing the things that, quote, Canadians want to get through the House. And he also attacked the Conservatives around C10. That's the modernization there of the, as you say, relation to cultural industries, and said that the Conservatives have never been there for them. That very much a play to Quebec. Janice, how did you interpret the Prime Minister's more political comment?
Well, a bunch of them, quite partisan, as you say, in tone. I think it was the tone that struck me. Not that it's surprising, for example, for Justin Trudeau to be defending his defense minister in the aftermath of a vote to censure him, after people saying all day in the Commons yesterday that he should resign or be fired. But his choice of words in the defense of Harjit Sajjan, portraying him as someone who was trying to bring change to a department led by an old boys club. I paused hearing that, pondering that this is a leader of a G7 country, a NATO country, dismissing the immediate past and I think, present leadership of his armed forces as an old boys club. Now, I know there are some people listening saying, we hear about that golf game with the former CDS Jonathan Vance, and we hear about some of this other behavior, and, the truth hurts. It does seem like an old boys club to me, but extraordinary that the Prime Minister himself would use those words at a news conference at a time when I can only imagine how tense the relationship is between the centre, the bureaucracy, and the military leadership, as they work through this. So I thought that was extraordinary. I also noted, though, Paula Rodriguez yesterday listing off the priorities for what they were going to do. They only have a couple sitting weeks next week. That's it. He was still listing C10 yesterday. As of this morning, the Prime Minister not listing it as something he wanted to get done. You heard a reporter ask him about that specifically, and he's framing it on the senators, conservative senators, who are sending signals that they were going to put up a fight on this. But you know what? That's kind of convenient, because the House management for that legislation has not been A+. It had a shambolic trip through committee and various amendments and whatnot. If they can suddenly blame this on the Senate Conservatives and campaign on it, power to them. But if you followed the path of that legislation through the spring, there is more to that story.
Yeah, and we should just say the House is going to rise, and as Janice points out, sometime next week. It is normal to have a high degree of partisanship and back and forth at the end of any sitting. But there have also been lots of farewell speeches over the past 2 weeks, which again feeds into the notion that maybe this version of the House won't in fact be coming back in September as predicted. Okay, both of you, I'm going to leave it there if you don't mind. Janice McGregor, thank you so much. David Cochrane, you're hosting Power and Politics later today. Lots to talk about, so that's good. We're going to take a short break. When we come back on CBC News Network, we'll have the ongoing briefing by public health officials and federal ministers. We'll get some more details about the delivery of Moderna vaccines, now slated to be 68 million of all vaccines delivered to this country by the end of July. I'm Rosemary Barton. Stay tuned. You're watching CBC News Network.
You're watching this live here on CBC News Network. On your screen is Procurement Minister Anita Anand, and she's giving us an update on the vaccines coming into Canada. Also part of this Public Health Agency of Canada and ministerial officials COVID-19 update is the Chief Public Health Officer of Canada, Theresa Tam. We'll see her soon, but we'll listen in live together here on CBC News Network.
Yesterday, approximately. Our government has delivered more than 35 million doses to the provinces and territories, with 30 million doses administered already to Canadians.
I want to wholeheartedly thank every Canadian who has stepped up to get vaccinated and encourage anyone who has not done so to get their first dose. As I have mentioned before, my officials and I have been working hard to get more doses delivered to Canada more quickly.
As a result of those efforts, as the Prime Minister has just indicated today, we are pleased to report that Canada's allocation from Moderna for the month of July is 11 million doses. What's more, these deliveries will be front-end loaded, with nearly 5 million of those doses actually arriving before the end of June, and the balance to be delivered in the first half of July. Along with the 1 million doses that we received from the United States government yesterday, Canada will receive a total of more than 18 million doses of Moderna in this quarter, well over the approximately 12 million doses originally forecasted.
As was also mentioned earlier this week, Pfizer has adjusted its July delivery schedule Let me be very clear. Canada will still receive 9.1 million doses of Pfizer in July. That has not changed. However, the deliveries in the first 2 weeks will now be lower than originally planned, and deliveries in the last 2 weeks will be higher to compensate and make up the difference.
As was also mentioned earlier in the week, Pfizer has adjusted its July delivery schedule. Let me be very clear. Canada will still receive 9.1 million doses of Pfizer in July. That has not changed. However, the deliveries in the first 2 weeks will now be lower than originally planned, and deliveries in the last 2 weeks will be higher to compensate and to make up the difference. In total, Canada is now set to receive more than 50 million doses by the end of June and more than 68 million doses by the end of July. This milestone in our vaccination campaign is the culmination of the monumental efforts of my PSPC team, who have worked around the clock since day one, continually negotiating with our suppliers in a relentless push to accelerate deliveries from later to earlier time periods this year. Our vaccine plan is paying off. We are seeing the results today, and our government will continue to bring millions of doses here for Canadians every single week. As the vaccines continue to arrive, let us pledge to continue to work together to keep each other safe and to finish the fight against COVID-19. We have come so far. Let's keep going. Merci beaucoup, Megwetch. Thank you.
Merci beaucoup, Anita. Thank you very much. So over to you, Dr. Tam, and then to Dr. New.
Thank you, Minister. Bonjour à tous. Nationally,
Hello, everyone.
7-day rolling averages continue to decline, and our current national average of 1,137 cases reported daily is down more than 85% from the peak of the third wave. Likewise, the average number of people with COVID-19 being treated in our hospitals each day is down more than 65% since the peak to 1,430 daily. Of these, on average, 650 people were being treated in intensive care units, and an average of 20 deaths were reported daily. Together, we've made incredible progress in lowering COVID-19 infection rates by maintaining precautions while we work to increase population immunity by expanding first dose vaccine programs and accelerating the second dose programs. The payoffs now and in the weeks and months to come will be invaluable. Just this week, healthcare workers had cause for great cheer as the Medical Surgical Intensive Care Unit at the Toronto General Hospital announced 0 COVID-19 patients for the first time since March 2020. In addition to preventing more severe illness and loss of life, our continued efforts to drive COVID-19 infection rates down everywhere is preparing us for a safer future by building a better buffer against the rise of the Delta variant. As we've seen every step of the way, the secret to all our successes has been people in Canada working together to stay informed, to help out in more ways than we could have imagined, and to step forward when it mattered most. And right now is an incredibly important moment for stepping up to get fully vaccinated. With COVID-19 disease activities waning, we have a window of opportunity to raise immunity as quickly and as high as possible to build a wall of protection through vaccination against emerging variants of concern like Delta. This week, we saw a great response to the start of the Pass the Baton COVID-19 vaccination campaign. The Canadian Olympians and Paralympians starting a relay of reasons on the importance of getting vaccinated against COVID-19. And using hashtag #MyWhy, people across Canada are joining in and sharing their own compelling stories, from protecting our health and healthcare system to getting back to the in-person connections that enrich our fitness, fun, learning, and growth. In short, Canadians are doing it for themselves, their families, their loved ones, and to be the coverage we want to see in the world. Working together, we can go for gold and get Canada back to the max. Thank you. Merci. Megwit.
Bonjour à toutes et à tous.
Hello, everyone. On the national level, the 7-day rolling average continues to decline. The current national average of 1,137 cases has gone down by more than 85% from the peak of the third wave. Likewise, the average number of people with COVID-19 being treated in our hospitals each day is down more than 65% since the peak to 1,430 daily. Of these, on average, 650 people were treated in intensive care units, and an average of 20 deaths were reported daily. Together, we've made incredible progress in lowering COVID-19 infection rates by maintaining precautions while we work to increase population immunity by expanding first-dose vaccine programs and accelerating second-dose programs. The payoffs now and in the weeks and months to come will be invaluable. Just this week, healthcare workers had cause for great cheer as the Medical Surgical Intensive Care Unit at the Toronto General Hospital announced 0 COVID-19 patients for the first time since March 2020. In addition to preventing more severe illness and loss of life, our continued efforts to drive COVID-19 infection rates down everywhere is preparing us for a safer future by building a better buffer against the rise of the number of cases and the Delta variant. As we've seen every step of the way, the secret to all our successes has been people in Canada working together to stay informed, to help out in more ways than we could have imagined, and to step forward when it mattered most. And right now is an incredibly important moment for stepping up to get fully vaccinated. With COVID-19 disease activity waning, we have a window of opportunity to raise immunity as quickly and as high as possible to build a wall of protection through vaccination against emerging variants of concern like Delta. This week, we saw a great response to the start of the Pass the Baton COVID-19 vaccination campaign, with Canadian Olympians and Paralympians starting a relay of reasons on the importance of getting vaccinated against COVID-19. Using hashtag #MyWhy, people across Canada are joining in and sharing their own compelling stories, from protecting our health and healthcare system to getting back to the in-person connections that enrich our fitness, fun, learning, and growth. In short, Canadians are doing it for themselves, their families, their loved ones, and to be the coverage we want to see in the world. Working together, we can go for the gold and get Canada vaxxed to the max. Thank you. Miigwech.
Thank you very much, Dr. New. And alors, to you, Jean-Sébastien, we're obviously ready to take questions.
Merci beaucoup, Monsieur le Ministre.
Thank you very much, Minister. We'll now start the question period.
Questions. As usual, it will be one question and one follow-up. Donc, comme d'habitude, ça va être une question et un suivi. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Thank you. Merci. Please press *1 at this time if you have a question. s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mike Lecouteur, Global News. Please go ahead, à vous la parole.
Thank you for taking our questions. This question is kind of split into two, one for Dr. Tam and one for Dr. Anand, Minister Anand, but both along the same subject. So with NACI's change yesterday and essentially recommending that provinces stop administering AstraZeneca, for Dr. Tam, I know you say that people should be happy that they followed the guidance and that they got their doses or first dose of AstraZeneca. There's still a number who feel like they're guinea pigs and they're not 100% sure they'll be able to travel to different places. So despite following everything, what do you say to those people? And the other one now for Minister Anand is we have the remaining of the contract of AstraZeneca. What happens to those doses now that it seems like they won't be used in Canada?
Yes, thank you for the question. And I can certainly recognize that people may be asking questions or feel frustrated. But I think, as I said yesterday, NACI is following the science and providing up-to-date recommendations. So the most important thing is to get that second dose. And I think that people who've got 2 doses of AstraZeneca should know that they are being protected in terms of illness. And in fact, the AstraZeneca dose, even if you look at the Delta variant, if you get 2 doses, you have a very effective vaccine for preventing hospitalizations or serious outcomes. What you're weighing your choices against is, some emerging evidence showing that if you receive the first dose AstraZeneca and then you receive an mRNA vaccine, that immune response appears to be very robust and is when the studies were done to compare 2 doses of AstraZeneca with AstraZeneca mRNA, the latter appears to produce a more robust response. So, and this, as you're making that kind of decision, is weighed against where you're in the pandemic, as well as the rare side effects that we've talked about, like the thrombosis with low platelets. So there's many things that I think each individual person receiving a vaccine, of course, should be provided information on. At the height of the pandemic, the absolute imperative is to protect everyone from getting serious illness. So that's what people who've got the AstraZeneca vaccine did for themselves, as well as to protect others as well. NACI's recommendation is one of, prefer to get the mRNA vaccine because they're in plentiful supply. The studies, as I've just indicated, now you have less COVID in our country, and so the risk-benefit ratio for the even rare events start swinging in a different way. But you are, if you got your 2 doses, protected. Today, all the evidence shows it protects very well against serious illness. I do think that needs to be separated from travel requirements. For travel requirements and what might be accepted in other countries is a very topical topic for international discussion. But you got to start somewhere. And I do think most countries is going to start off with the vaccines that they know and have approved. We will also be looking at, for example, the WHO list of approved vaccines. But every country currently is trying to restart doing the best that they can. And they may start off with a smaller list. And they, like us, would be considering other vaccines as we're going along as well. So it is difficult. And for travelers, as I said yesterday, you have to check what the policy of the country that you're traveling to is requiring. The incident in the United States, I think that was reported about a concert. Now, that could, in fact, be a state or local or, private sector policy. I don't know. I don't have enough information. So I think from our perspective, our continued engagement will be with the national level of the United States.
It's Dr. New. Maybe I can just underline a point that Dr. Tam made, and also to your question. Certainly, the NACI recommendation is not to tell provinces and territories to stop using AstraZeneca vaccine. Based on scientific evidence about maybe a possible advantage in terms of immune response by offering an mRNA vaccine as a second dose to those who received AstraZeneca as a first dose, and also the very rare, but there is a safety signal with VIT. There is a sort of a recommendation for a preference, but it's not the same thing as saying stop using AstraZeneca totally. So certainly for those individuals who's received the AstraZeneca vaccine, the 2 doses, hey, you've made a good choice. Certainly, I can say at the time when the epidemic, the third wave was raging through the country, it offers a good level of protection against infection. Of course, very good protection, as we can see with evidence around the world in terms of serious illness and hospitalization. So certainly now with the additional information, provinces and territories will be taking that to heart. But certainly my sense is that if an individual, for whatever reason, is maybe not comfortable with quote, receiving a sort of the mixed dose, or getting a different type of vaccine, mRNA, as their second dose after receiving AstraZeneca, certainly my sense is that option would be made available, obviously with full informed consent, understanding what they're doing. But it's not a hard stop to say, no, you cannot give AstraZeneca at all. So I just want to make sure that that's clear as well. Thank you.
And just to respond to the second part of your question, Mike, I will start off by saying that as a result of our diversified portfolio of vaccines, we are continuing to pull in vaccines from multiple approved suppliers. The reality is that we are working very hard with Minister Hajdu's team and the Public Health Agency of Canada as their engagement continues with the provinces and territories to determine the extent of their demand for AstraZeneca. Our contractual relationships with suppliers and our contracts themselves are extremely solid, and we will be able to meet any demand that ensues from the provinces and territories. As you have seen already, we have almost 75% of eligible Canadians with at least 1 dose. Second doses are continuing to ramp up. And from the perspective of public services and procurement, we will continue to ensure that the supply of vaccines rolls into Canada by the millions, 50 million before the end of June, 68 million plus before the end of July, so that all Canadians who wish to have access to vaccine can indeed have that access. Thank you.
Just for my follow-up, Minister Anand, I appreciate that, but the question was, what do we do with the unused vaccines or the rest of them? But that's not my follow-up. I don't know if you want to address it afterwards. I understand that doses are coming in, but we may no longer have use for AstraZeneca, is what I'm saying, and what do we do with those doses? But I will, so you can tackle that after I ask my follow-up, but my follow-up is for Dr. Tam and possibly Dr. New. I wanted to know what the vaccine threshold should be to ease restrictions in light of the spread of the Delta variant, and whether or not there is a concern that we could be seeing a drop-off in uptake of first doses in Canada.
Okay, Teresa, I'll just start by finishing the response to the question and then hand it over to you if that's okay. In terms of the unused vaccine that is available under contract, I want to reiterate that Canada is committed to helping to meet global demand for COVID-19 vaccines. As announced by the Prime Minister, Canada has committed to donating up to 100 million doses. This continues to be a conversation across government as to further donations when that is possible. I will continue to be focused on bringing vaccines into this country, and will discuss with my colleagues the resulting decisions relating to unused doses under contract. Teresa?
Thank you. And that was a very important question, and that the last part of a vaccine stretched campaign is the hardest. So far we've seen such a tremendous enthusiasm from people, but the last remaining people who haven't had their first dose yet is an important target of efforts to get more vaccines to them. So now the tactics may have to switch, for example, from mass immunization clinics, which can still occur, but to more tailored approaches to improve access to those who still haven't been vaccinated, but that they may have had difficulties accessing the vaccine. So you will see numerous different strategies to bring vaccine to the harder to reach, to people who are homebound, to other different communities. And we, the federal government, the public health agency, supported a number of community-based projects in order to get those vaccine targets up. It may be language barriers. We're pulling out all stops. But that end piece of our campaign is going to be the most difficult. So in some jurisdictions, we've already seen a slowdown of that first dose while the second dose is ramping up. We need to keep going with that first dose. And as you said, it's because some of the variants who are more transmissible may need a higher vaccine coverage in the community to stop chains of transmission. We will be, doing more modeling information and studies, but all to say is that's why I've said we've got to reach for the stars. We've got to, as much as possible, even get past the 75% goal. We know it can happen because certain age groups, the seniors, for example, some groups have already gone past 90%. So if other age groups can be supported to do that, that's what we would want to see. And that sets us up for a much better fall. If the variant takes hold and we don't have high enough vaccine coverage, what you will see is probably a resurgence in the fall period, which we want to try and suppress as much as possible.
Yes, and it's Dr. New. Just to build on what Dr. Tam said, you're right. We're seeing in different parts of the country that sort of the rate of vaccination for first doses is starting to slightly plateau, and certainly not at the same sort of accelerated pace as it was earlier. And there's two components to that. One is Dr. Tam's very eloquently expresses the accessibility part. People are homebound. Maybe it's not easy for them to get an appointment or to actually go for their vaccine. And so we see that the provinces and territories are using all sorts of means to improve access to vaccine, and even language and cultural barriers. That's one thing. But the other part is the vaccine hesitancy. That's another space that we're very alive to with our innovation fund, and also the provinces and territories. You can see they're using other methods as well, as you might say, to try and appeal to maybe other motivating aspects to why people may then hopefully go forward to get the first dose, and of course then for the second dose. So those are important things that hopefully we'll get way past that first dose coverage, and then as you say, start focusing on the second doses for all Canadians. Thank you.
Thank you, Dr. New. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous tous.
Question. Hello, everyone. My first question is for Minister Anand. I would just like more details about the vaccines. 55 million doses is what was announced recently before the end of July. Now we're talking about 68 million before the end of July. So I was wondering, how can you explain this 13 million difference? Is it more doses from Moderna? If you could give me some details on that, please. Answer, yes, of course, and thank you for the question. The situation is as follows. The 55 million doses before the end of July was only for Pfizer doses, but now we have a timeline that includes Moderna, so we will have 68 million doses approximately before the end of July. Thank you. Very well. So you're saying that the 13 million doses is attributable to the Moderna vaccine, if I'm not mistaken. Follow-up question. For Minister Leblanc, I wanted to come back to travel and the proof of vaccination. Earlier, Prime Minister Trudeau said that there would be a solution, an interim solution for this proof of vaccination using the Arrive Can application. And he said at the same time that there would be a more permanent solution in the fall. I was wondering, what is blocking this process currently? That is to say, is it negotiations with the provinces or is it because of privacy? Could you elaborate on that, please? Response, with pleasure. Thank you for the question. I think Prime Minister Trudeau addressed this earlier today, and you're right. There will be an interim solution, and we'll provide more details Monday on this. And it's in order to offer through the Arrive Can application a way for eligible individuals to come to Canada to show their proof of vaccination. And we're continuing very constructive discussions with the provinces and territories. This was raised during a meeting, once again, a very fruitful and productive meeting yesterday evening with all the premiers. It lasted 2 hours, and the conversation focused on the details as to how we can collaborate together and how we can work together while respecting privacy and have access to data, which of course belongs to the provinces, so that we can get come up with a more long-term solution for a type of passport or a certificate that proves vaccination occurred. And this was addressed with our allies and the US, of course, and the European Union, with England. So over the coming months, we will have a safe way, in partnership with the provinces, to offer all Canadians a proof of vaccination for international travel. Thank you very much, Minister. Dr. Tam and Dr. New must leave us now, but the two ministers will remain.
Dr. New must leave, but the ministers will remain available to answer your questions. Donc, je vais passer la parole à l'opératrice pour la prochaine question.
Jean-Sébastien, it's Dominique here. I believe Dr. New can maybe stay with us for a few moments more.
With us for a few minutes. It's Dr. Tam who has had to step out.
Ah, OK. That's right. Parfait. Ben, merci de la précision, Monsieur le Ministre. Donc, parfait. Je vais passer.
Thank you for specifying that. Now I'll hand it over to the operator.
The next question.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Thank you. Yeah, Dr. New, I'm just wondering if you could talk a little bit more about this NACI decision yesterday on AstraZeneca. I've seen some family doctors and pharmacists not happy with this decision. They say that it created more confusion for patients. There was no documentation provided that was sort of patient-friendly so they could explain it, that there doesn't seem to have been that much change in the data and the studies. They're all still sort of early emerging data, and that this has just added extra confusion and concern for patients. I'm just wondering if you could address those concerns.
Okay, well, thank you very much for the question, Mia. What I would say is that with respect to the NACI guidance, as we've said on several occasions, that continues to evolve with the science. And the science is some of the studies coming out of Europe, looking at healthcare workers, looking at their immune response, are all very positive in terms of looking at a mixed dose schedule. The fact that there seems to be a better immune response for individuals who receive an mRNA vaccine after having received AstraZeneca as their first dose, but also the fact that people who receive AstraZeneca for their first 2 doses, that there's a very good level of protection. So we understand all that. So I think what's driving the NACI change in terms of sort of a stronger recommendation, a preference for that mRNA vaccine as the second dose for those individuals who receive AstraZeneca as their first dose, is based on the fact that, like I said, the immune response appears to be greater. And also with the fact that even though it's quite rare, the fact there is a safety signal with the AstraZeneca vaccine, which was not there, when we first started our vaccination campaign with all of the vaccines that were obviously approved by Health Canada. And that safety signal has not been shown to be the case with respect to VIT, the blood clots with the mRNA vaccine. So that I think is there. The provinces and territories were given a sort of advanced briefing of the NACI recommendations, so they're well aware. And certainly it's within their jurisdiction to take the NACI advice and recommendations and then operationalize it according to the context, their epidemiology, and what works best in their jurisdiction. So to your point about at the pharmacy level in terms of patient handouts and so on and so forth, certainly that's something we would leave to the province and the territory to know best, as they say, their residents and what might work best at a local level in terms of patient information. As I said earlier in my to previous question, is that for people who receive both doses of AstraZeneca, you've done well. You've protected yourselves, you've protected your family, you have good protection against infection. Certainly, you decreased the overall risk of onward transmission of COVID-19, certainly at the time when there was the third wave raging through many parts of the country. And also, you decreased your risk substantially in terms of severe illness and hospitalization. Now, with the fact that we have many millions of doses of mRNA coming in, the fact also that I think in many ways they're showing that there's a good immune response or better immune response with that second dose. That's why there is that option, that preference. But I think it doesn't discount the fact that for individuals who have received that first dose and still, for whatever reason, feel uncomfortable getting a dose of another sort of vaccine type and would like to complete their series, certainly my understanding at the provinces and territories, they will take that into account. And certainly as they roll out the vaccines, that would be part of the, I would say, the logistical aspect in terms of taking the orders that, from obviously the federal government in terms of the number of vaccines they anticipate being able to use in that respect. So I think at the end of the day, the fact is that we have a suite of vaccines in Canada. We're doing very well, as Minister Anand has said, with respect to first dose vaccination. Hey, 75% of Canadians have now received one dose, I would say eligible Canadians, and now we're moving in very well with the second dose coverage. My understanding is that we're closing in on that 20%, and as you can see, provinces and territories are taking that to heart, and they're moving ahead with their reopening plans, I think, hopefully in a cautious way, looking obviously to make sure that they're not having an adverse impact on the community transmission, and more importantly, straining the healthcare system in terms of hospitalizations. But all things are trending in the right direction, and so I think we just need to keep pushing in terms of vaccination for Canadians.
Thank you. And I'd also like to ask you about the Delta variant and what we know about it in terms of tracking it. It seems the Health Canada website that tracks variants still does not have a Delta or any of the B1617 lineages on there. It seems difficult to get that data at a provincial level. Is it actually harder to figure out whether this variant is in place? Does it take longer? And what does that mean for our ability to actually control any outbreaks?
Well, you've raised a very good issues in terms of data gathering. Certainly at the federal level, we work closely with our provincial territorial counterparts to get data. But you're right, there is a bit of a lag, and we do rely on the provinces and territories in terms of when you do get obviously laboratory confirmation of cases of COVID-19 to the extent that they can, I just say, sequence the variants to determine if it is a variant of concern, and then transmit that data to us. That there is obviously some issues that we need to obviously work on at the present time, and it keeps changing. Is that I'm aware of in terms of the Delta variant. As of today, I was looking at the latest data. There's about 2,000, a bit over 2,000 cases that have been reported to us, but we always appreciate the fact that it's probably an underestimation. There's probably more cases there. The other aspect that we're also learning from our provincial and territorial colleagues is that, and I think it underlines an important point, is that the Delta variant, certainly some of the outbreaks that have been reported are among unvaccinated individuals, and certainly because the variant has been shown to be more transmissible and obviously also maybe lead to more serious illness. It just underscores the point that people need to get not just that first dose, but that second dose as well. Studies and the experience in countries in Europe have shown that there's a good level of protection against a Delta variant with one dose, but it's much better with 2 doses. So the quicker we can get everyone to receiving their 2 doses, the better we'll all be in terms of, how you say, being protected against COVID-19 in general, but more specifically the Delta variant. So it's something where we're tracking with our PT colleagues, as we say, and it's something that we're very alive to in terms of tracking the outbreaks and looking at what we can do. And I would say especially what we might call pockets of unvaccinated individuals throughout the country.
Thank you, Dr. New. Merci, Dr. New. Donc, opératrice, pour la dernière question et dernier suivi. So, operator, over to you for the last question and follow-up.
Thank you. Merci. The last question is from La dernière question est de Brian Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, I'm wondering with the shipments that you announced today, it would seem that we should be able to vaccinate all the currently eligible Canadians in July or at the latest in early August. I'm wondering what you think the likelihood of that is, and whether or not there are any roadblocks that have you concerned when it comes to being able to vaccinate Canadians that quickly.
Should I start, or Minister Anand? I think there's 2 parts to your question. Maybe it's Dr. New. I'll start in terms of the actual administration of the vaccine. Certainly, as we work with our provincial territorial colleagues, the public health capacity, the actual capacity to administer the vaccines is there, and they're ramping up, and you can see that the doses are being administered at a very good rate. But in several provinces, the rate is starting to slow down in terms of first vaccines administered. And so, as we've mentioned earlier, the issue of, I guess you might call it either accessibility or vaccine hesitancy is now coming to the forefront. So with respect to accessibility, certainly the provinces and territories are very live to that.
Maybe I'll take over until Howard gets back. Ryan, is that all right? Listen, in terms of the supply, you're exactly right. We do have a steady stream of vaccines coming into the country, and the announcement today is very good news. 50 million plus before the end of June, 68 million plus before the end of July. But the reality is that there are a number of factors that need to be taken into account, and it is for that reason that we are sticking with the time frame that we've previously discussed, being the end of September. What are those factors, you ask? First of all, supply chains are still volatile. There is still a global competition for vaccine. We are watching our supply chains extremely carefully watching every plane land and every shipment get out to Canadians. So I'm not taking my eye off this ball until we have enough vaccine in the country for all Canadians, and that means continuing to operate in this globally competitive environment. The second factor that we should be aware of is that while we have supply in the country, we are still making sure that that supply gets out to the provinces and territories as soon as possible. And then the shots have to go into arms. And so making sure that those factors are taking account of in the process of the timeline and the estimations is extremely important. As you know, we are being extremely careful with our procurements and with our distribution of vaccine to make sure that things stay on the right track. But this is a process, and we will continue to draw down on our very strong contracts to ensure that all Canadians have access to two doses of vaccine as soon as possible. Thank you.
Yeah, I guess just as a follow-up, Mr. I know you said before that Canada paid a premium to be able to pull doses from later in the year into earlier in the year. Are we still doing that? And can you provide us an estimate of what that has cost to move up all of these doses?
Well, to be clear, Ryan, the payment to each supplier depends on the terms of the contracts. And it is not true across the board that we pay a premium for doses that we accelerate. In fact, we have accelerated 34 million doses to date, and the contracts do differ on the extent to which we pay a premium for accelerated doses. So the conversations and the negotiations with the suppliers continue, but our goal, in light of the fact that we are in the middle of the pandemic and we are still requiring supply to get out to Canadians, is to bring in as many vaccines as soon as possible. I will reiterate that Canada has paid fair value for the vaccines that it has received. That is, we are continuing to negotiate with our suppliers for the most expeditious deliveries to Canada at the fairest price. Thank you.
Thank you, Minister.
Dr. New, just checking to see if you can at least hear me. Oh.
Yes, we can, Dr.
Oh, that's fine. For Minister non-answer, well, I guess my internet's still quite spotty, so I'm just here if there's any additional questions. Otherwise, I'll just stay off camera. Thank you.
And you've been listening to the Public Health Agency of Canada, Dr. Howard New, Anita Anand, the Procurement Minister, and Dominic LeBlanc. The CBC's Janice McGregor has been listening in live from Ottawa. So Janice, what stood out for you there?
I think I'm hoping this will help people. I want to walk people through everything we learned about Moderna shipments this week, because the numbers changed 3, maybe 4 times. And you're forgiven if you're sitting at home trying to figure all this out. So I'm